Hello my geniuses, welcome to another head and neck series. It's your great science tutor Lorenzo, and today we'll be talking about the skull. So the skull will be the first topic in our head and neck series we'll be talking about, so keep it locked then. Make sure if you are a new subscriber, make sure to subscribe in my video, like, subscribe, even drop a comment. Any video you want me to make for you, put it down in the comment section. I promise when I go to it, I'll make that video solely for you. And if you are confused about anything, also drop it down in the comment section. And also I'll be dropping my number too, so that you can send me personal questions so that I could explain and get back to you fast. So let's jump right into the video. So the first question we'll be asking ourselves is, what is the skull? What should we say about the skull? Now, the skull is the complex bony framework that forms the head of the human body. So in your head and neck now, which is the series we are doing here, so it's a complex bony framework that forms the head of the human body. And what are the three things it do specifically? It encloses and protects the brain. That's the first thing. We know it's a complex bony framework because we have all bones in our body, but the one that is more complex and more different because it's housing the central chambers of the human body, which is the skull. It encloses and protects the brain. It supports the structures of the face, because you see your face is being placed on your skull also, and it has some organs that are also in the face. So it supports the structures of the face. And the last one is to provide attachment sites for muscles. It also provides attachment sites for muscles, which are for mastication, facial expression, and for what? Head movement. Don't forget that. That is so important for you to remember. It's a complex bony framework that forms the head of the human body, and it does what? Encloses the brain and protects it, form attachment for the face and different muscles. You get it now? So the next to be talking about is the functions of the skull. We have just introduced what the skull is. It's so simple. So next is the functions of the skull. The functions of the skull, we just talk about four before we talk about the divisions now. So we have four functions. One, it provides, like I said, protection for the brain, which is covered by meninges. So the brain itself is inside the skull and is covered by what? Meninges. Two, now what does it do? Now it provides opening for the passage of food and air. So the skull will have an opening for the passage of food and air. So to your nose, you have the nasal skeleton. The nasal skeleton is through that, and the nasal bones is where air passes through, leave to the nasopharynx, which we'll be talking about later. So the next one, through food, to the oral cavity, your mouth too is also in the skull. So it allows for the passage of food and air, and it also protects the brain, covered by meninges. The next one is that it accommodates the teeth and the jaw for mastication. So you need the lower and upper jaw, which includes the teeth, where mastication can occur through the muscles of what? Mastication. And the next one, it provides the cavity and accommodates what? Organs for which are special senses. So special senses organs which are used for sight, which is the eyes, which is the ear for hearing, also the ear for equilibrium, and your smell, which is the nasal cavity, also through the olfactory nerve, which we'll be discussing, and the taste through the tongue, which we'll also be discussing. So these are the four functions we'll be talking about that the skull can provide human being with. So the next thing we'll be talking about is the division of the skull. So some people can call it the part of the skull, some people can call it the division of the skull. So simple. So since you look at the skull now, what are the two parts? Now you have the one that is superior, the one that is upper. We call it the cranium. Are you getting me? The cranium, or you can call it the cranial skeleton. So you have the cranium or the cranial skeleton. That if you touch your head superiorly now, that is your cranium. But some people call it neurocranium. So that is what anatomists call it. Another alternative way, neurocranium. You can call it neurocranium because it is the brain box. It's the brain box where the brain is protected with. So when you remove the top of the skull, you can expose the brain. Get it now? So that is the neurocranium. And the one that is anterior, which is your face, you call that one facial skeleton. So we have the neurocranium, or you call it the cranium, or you call it the cranial skeleton. The next one, which is anterior to us, which you are seeing on your screen, is the visceral cranium, or the facial skeleton. Are you getting me now? But the facial skeleton include the mandible. So follow it. It's just connected. So you have the neurocranium, which houses the brain box. Are you getting me now? Where the brain is, and you have the visceral cranium, which contain viscera. What are viscera? Your eyes, your nose, and all the stuff. You get it now? So easy. So now moving forward, now if I'm to explain what are the bones that are here. Now in the neurocranium we have about 8 bones. Are you getting me? Now in the neurocranium, which is the one that is covering the brain itself, there are about 8 bones, while in the viscerocranium or the facial skeleton we have 14 bones. You get it now? Neurocranium, or you call it the cranial skeleton, has 8 bones, while the facial skeleton, or you call it viscerocranium, has what? 14 bones. So one thing you have to know, inside the 8 bones, so remember I said 22 excluding the air ossicles. In the 8 bones we have 2 paired and 4 unpaired. So 2 are paired, which is 2 times 2, that is 4. 4 plus 4 unpaired, which is 8. So what are the 2 paired? You have the parietal bone, which you are seeing on your screen, the parietal bone, and you have the temporal bone. So the parietal bone is joined by a sagittal suture, which we'll be talking about. So we have the parietal bone joined by a sagittal suture, and you have the temporal bone close to your ear too at the other side. So what are the unpaired bones? Unpaired bones, that they are singular. So you have the frontal bone, which is in the front. You have the occipital bone, which is at the back of the skull. You have the sphenoid bone, which is also one, and you have the ethmoid bones. These bones are unpaired. You get it now? So which is 8 bones, 8 neurocranium or cranial bones, 8, 2 paired, 4 unpaired. So don't forget. Then you have your facial skeleton, which are 14 bones. Inside the 14 bones, now you have 6 are paired, 6 bones are paired, while 2 are unpaired. Hold it. 6 are paired, 2 are unpaired. But for the cranium or neurocranium, you have 2 paired, 4 unpaired. So don't forget it for your exam. So the paired bone, you can now have the maxilla. The maxilla is paired, just your cheekbone side, your maxilla. You have the zygomatic bone also around your cheek. You have the nasal too, joined by international suture. Now you have the lacrimal bone, which you are also seeing in your front. You have the lacrimal bone. You have the palatine bone that form your upper palate. Your lacrima is for your tear gland. Then you have your you have the inferior nasal concha too. It's also a bone. You get it now? Why the unpaired bones, you have the what? You have the mandible and you have the vulva. So the mandible is not paired. You get it now? So it's just an attached bone that forms the temporomandibular joint. And you have the vulva. Vulva, you can isolate it in the front. When you remove the nasal cartilage, you can see the vulva on your screen. Now, one thing you have to understand is very, very easy, and you have to understand all this thing I'm explaining to you, because it's very, very important. The next thing you have to know that the joint, the joint in the skull, I told you that all the joints in the skull are held by what? A suture. A suture is an immovable joint. Are you getting me? It's an immovable joint. It's a fibrous joint. It don't move. Are you getting me? And the connective tissue uniting this bone is the sutural ligament. Are you getting me? So there are 2 basic joints. You have the suture joint, the joint. You have 2 particular joints. You have the suture and you have the TMJ. The TMJ is movable, while the suture is immovable. The suture is holding the bones of the skull, while the mandible is joined to the skull by a temporomandibular joint. So I hope you're understanding it. It's very, very simple. It's very, very simple. I hope you get it. So the next thing we'll be going to is into now talking about the exterior part of the skull, which I'll be talking about in the next video. Again, now so we'll slice all the video into chunks so that you can get it. So I don't want it to be compacted, so we follow it small. So I hope it all made sense to you and you have understood everything I've talked about in the skull. So this is just the introductory aspect. Watch it. I want you to know all the bones of the skull, because it's very, very important if you know it, because that is the journey, knowing the journey of the head and neck playlist. So you start from this one, little by little you walk up to it. So if you are just joining us for the first time, make sure you subscribe, turn on your post notification button so that anytime I drop any video, you be sure to be notified. I will see you in my next video. Bye bye.